Hi, my name's Leo Mendez, and this is my Kidney 4380 Exercise Science Internship video presentation. For my internship site, I chose the Heart Institute of Brownsville, located at 213 Hart Drive, Brownsville, Texas. My reason for choosing this site as my internship is due to the fact that I do want to go to PA school. While interning there at the Heart Institute, my mentor was physician assistant Brando Ramos. Brando is a recent graduate from the University of Texas, Rio Grande Valley's physician assistant program. So I do believe I am in good hands. And I can say this with confidence because Dr. Habet always praises Dr. Ramos' hard work there at the clinic. And Dr. Habet himself is a well-known and respected doctor within the clinic and in the lower Rio Grande Valley. Some of the main responsibilities asked to me while interning there at the Heart Institute are the following: ask questions when needed, take notes as needed, shadow PA Ramos and the other PAs when the opportunity is present, occasionally perform auscultations of the heart and lungs, and occasionally perform manual blood pressure readings. My experience. Okay, some of my good experiences from interning at the Heart Institute are the following. I enjoyed the patient interaction. I do believe as a future physician, it is important to establish a interpersonal connection with your patient, and not just on a professional level, getting to know who they are, what they've been through, and all of that. I enjoyed when I'm allowed to be more hands-on with the patients, such as the auscultations and when doing the manual blood pressure readings. I enjoyed when able to answer a question asked by one of the supervising doctors there at the clinic in relation to a patient's case. I'm not always right, it's still a learning process, but when I am correct, it gives me a sense of empowerment, which keeps me moving forward. Just as anyone has their good experiences, everyone has their bad experiences, and here are a few that I highlight from my internship experience. It was disappointing when patients were denied some form of care due to their current insurance policies. It was disappointing when patients were hard to deal with. What I mean by this, for example, is when a patient prefers to see their PCP or their primary care provider, which is the doctor, or any other doctor aside from a physician assistant. They deem the PAs to be not as knowledgeable as an actual doctor, and it only prolongs their stay at the clinic. It was hard for me when emotions would flare up in the exam rooms when patients were given a diagnosis, and most of all, it was disappointing to see patients continue the same habits that landed them there in the clinic in the first place. For example, we have a few patients that go to the clinic for severe PAD or severe peripheral artery disease. One of the main causes of PAD is smoking. Some of these patients have been smoking for years and years, and we've asked for them to undergo cessation of smoking. But we've actually seen a couple patients, as soon as they walk out of the clinic doors, they are literally smoking on their way to their car. Not much we could do there. What I learned from my experience, while interning there, I was able to learn which medications to prescribe to patients, when or when not to prescribe certain medications to patients, a more thorough understanding of the heart. This is simply due to the fact that the clinic is a cardiology-centered clinic. I learned blood pressure, blood lipid, and blood glucose goals for patients who are diabetic, post any cardiac procedure, etc., and how to properly read an EKG and identify abnormalities. For my project, I was assigned to the Department of Nuclear Medicine, where I assumed the title of Nuclear Medicine Assistant. I was assigned to this due to my exercise science background and experience with stress testing via Bruce protocol. The hardest thing for me to get used to while performing my project was the clinic's use of 220 minus age. This was difficult for me to get used to at first, or wrap my head around, due to the fact that throughout the exercise science degree, we were told 220 minus age can leave room for an overestimation of an actual mic's heart rate. But seeing as it is a clinic and they're usually backed up and rushed, 220 minus age seems logical to use. Aside from this, completing this project was enjoyable due to my experience and knowledge in executing a proper Bruce protocol stress test. What lies ahead? I will be returning to UTRGV to pursue prerequisites for PA school. Before this internship, all I knew was I wanted to be a PA. I did not know which specialization. Now, thanks to this internship, I now know I want to be a PA with a specialization in cardiology. I will continue going to the Heart Institute even after this internship is technically over for school-related purposes, and I hope in doing so I will have one foot through the door leading to my future. And after all of that, it is still to be determined. This one's for you, Dr. Funk. I wasn't always an exercise science major in all of my years there at UTRGV. I still remember the first time I switched over to exercise science and I underwent your biomechanics class, and it really opened my eyes to the field, and you left a lasting impression on me not many professors at UTRGV were able to do. So I thank you for that. Thank you for being the awesome professor that you are, and I do hope you leave more lasting impressions on your newly found peers on your new journey. With regards, Leo Mendes.